So, dear students, the today topic is a pharmacology of androgens. So, androgens are the hormones. So, they are play important role in the development of the body in both female and as well as the male. But it is more involved in the to regulate the all development functions in the male as compared to females. So, regarding introductions, so androgens are a group of steroids so that have anabolic effect as well as the musculinizing effect in both males and females. Anabolic effect means so they are always involved in the to enhance the protein synthesis. So that to increase the protein synthesis, so that effect of androgen is account for the anabolic effect. So due to increased protein synthesis, the development of the body was increases or it can regulate the growth of the human body through a enhancing the protein synthesis. So that effect is known as the anabolic effect. So anabolic effect means always it is involved in the to build up of the macromolecules or larger molecules by utilizations of the small molecules or amino acids. So they can utilize the amino acids and involved in the synthesis of the desired proteins. So that effect was known as the anabolic effect. And same androgens, so they are also having the musculinizing effect. It means they are involved in the to build up the mass or the mass number, the mass size was increases under the influence or secretions of the androgen. So that's why in the male the body buildup or the physics of the body is mainly depending upon the androgens. If the androgen is less secreted, so then there is a loss of the body weight or the body weight cannot be gained due to lack of the androgen. So that's why the androgens are responsible for or it can regulate the development of the body through by showing a anabolic effect as well as the musculinizing effect. So regarding the source, so androgens in the male, the source of androgen male is a testes. So testes, so they are responsible for synthesis of the androgen by utilizations of the cholesterols. Okay, by utilization of cholesterol, so they are involved in the synthesis of the androgens like a testosterone, dihydrotestosterones, many others are there. But in female, the ovaries is also secrete a small quantity of the androgens. Okay, so that's why the androgens they are involved in the regulations of the development in both male as well as the female, because the female having ovaries, so they are secret the less amount or negligible amount of the testosterone or androgens. If its concentration is more due to any abnormalities, any problems, so then the female is suffering from the ovarian cancers or uterus cancers. But if it is negligible up to that, it does not produces any side effects or any diseases. When its concentration is more or it can more synthesized, on that time only it is involved in the cause of the ovary cancers or fallopian cancers or uterus cancers. But in both male and female, the adrenal glands and the fat cells are the source for the synthesis of the androgen. So these are the various sites from which the androgens are secreted in the male, that is testes, adrenal gland and fat cells. In the female, that is the ovaries as well as the adrenal gland and fat cells, because the fat cells, so they contain the rich of cholesterol, and cholesterol is the starting material for synthesis of the androgen, for synthesis of the estrogen, for synthesis of the progesterone. So that's why cholesterol it's play important role in the synthesis of the steroidal hormones or synthesis of the that is the sexual hormones like testosterone, estrogen and progesterone. So regarding the physiological rule, the androgens, so they are play important role in the to regulate the maturations in the male. So lack of testosterone or lack of androgen in the male, the maturation phase cannot be achieved in the males. Then as well as the androgens play important role in the sperm productions because the testosterone it can regulate the spermatogenesis. So that spermatogenesis is nothing but the synthesis or productions of the sperm. So that is mainly depending upon the androgens are mainly depending upon the testosterone. So that's why the testosterone or androgen it's play important role to maintain the fertility of the male. Lack of testosterone, then the person is suffering from the infertility. Okay. Then also the androgens, so they are enhance the synthesis of the muscle proteins and as well as hemoglobins. So as the hemoglobin synthesis increases, the transport of oxygen is increases. So as the transport of oxygen is increases, then all the cells they can utilize the healthy oxygen then involved in the metabolic function, synthesis of the proteins and other substances. So due to that, the body can be built up and as well as it can enhance the synthesis of the muscle protein. So that is helpful for to increase the muscle mass or to build up the body under the influence of the androgens. So androgen they also strengthen the bones by inhibiting the bone resorptions. Okay, the androgens or testosterone they can strengthen the bones or they can make the strongest of the bones by inhibiting the bone resorption, that is the release of the calcium from the bones by inhibiting the activations of osteoclast. So osteoclast are the one type of cells, so those are present in the bone, so those are involved in the to regulate the bone resorption. So that process was inhibited by testosterone. So due to under the influence of the androgen, the bones are the strong and lack of androgen. So after crossing certain age, the bones become the weak in the old peoples due to lack of the testosterone. They are having the good testosterone means so their bone can be strong up to the death. And testosterone secretion is mainly depending upon the CNS or the conditions of the CNS. If our brain is relaxed or healthy, free from the stress, free from the anxiety and free from the depression, then only the CNS or cerebral cortex it can receive the message from the organs, message from the blood, then it can involved in the send message to the hypothalamus, then hypothalamus it can releases the GnRH, that is gonadal releasing hormones or gonadal releasing factors. So this factor it released from the hypothalamus when the androgen level in the body is decreases. So due to chemoreceptors or many other receptors, so that signal can received by the cerebral cortex. Then cerebral cortex is integrated if it is stable, if it is healthy, if it is relaxed. If it is stress or depression or anxiety, then it can fail to recognize the message from the chemoreceptor. So on that time it can fail to secrete the testosterone. So that's why the hormone secretion is mainly depending upon the CNS. So those are healthy, so those are free from the depression and stress up to death, their bone cannot be deteriorate. Okay, up to the death, so that they are having sufficient concentrations of testosterone, so that testosterone it can avoid the bone resorption. So that's why they are the strong. Okay, as compared to, so those are living in the stress, those are living in the anxiety or those are living in the psychosis or depressions. Okay, so this release GnRH, gonadotropin releasing hormone, it can enter towards the enter pituitary part of the glands. So where it can activate the gonadotropic cells. So then the gonadotropic cell they can releases the LHS and as well as the FSH, that is luteinizing hormone and follicle stimulating hormone. So this LH or luteinizing hormone it can act on the testicles or testes in the male. It can stimulate the release of the testosterone. So like that the testosterone secretion is mainly depending upon the releasing factor from the hypothalamus. If any problem in the hypothalamus or any cancer in the hypothalamus, so on that time the GnRS do not release. So due to that, that person is suffering from the deficiency of the testosterone. So where the weight can gradually decreases, or he become the libido, or the sex desire was decreases. So these all are indication of the hyposecretion or low secretions of the testosterone. So on that time, so doctor they can treated that with the help of the synthetic androgens or synthetic testosterone or dihydrotestosterone. It can correct the all the problems related to the testosterone. And testosterone is also play important role in the erectile functions. If it is lack, the erections does not occur. So due to that, the person is suffering from the infertility or libido. So due to that, he do not have any desire on the sex. So that is indications of the low secretions of the testosterone. If you administer testosterone, or you can naturally increase the testosterone secretion in the body with the help of the a healthy diet, then the testosterone concentration can be normalized. Okay, so next one regarding the classification, the androgens, so they are mainly classified into two class, that is the natural androgen, so they are secreted in our body, and synthetic androgen by chemically with the help of the medicinal chemistry we can synthesize the artificially. So those are known as the synthetic androgens. And synthetic androgens examples are methyl testosterone, fluoxymestrone, then as well as the testosterone, that is undecanoate, then as well as the masterlons. So these are the synthetic androgen. So where the person having the deficiency of the testosterone, or that person can suffering from the less sperm number. So because the sperm production is mainly depending on the testosterone. If testosterone less mean the sperm count can be decreases. If the sperm count is decreases means the infertility is occurs, or inability to childbirth is produces in the male. So that can treated with the help of the synthetic androgens like a methyl testosterone, fluoxymestrone, as well as the testosterone and undecanoate and the masterone. And regarding the natural androgens in our body, in the male especially, the testes they can secrete the testosterone, that is 5 to 10 mg daily. Okay, but in female the ovaries is also secrete the testosterone, so that concentration should be the negligible, about only 0.25 to 0.5 mg per day. If it is concentration is more secreted from the ovaries, so then that candidate or that female is suffering from the ovarian cancers or uterus cancer. And synthesis of the testosterone or androgen is mainly depending upon the cholesterol. If cholesterol is more in the ovaries means it can secrete the more testosterone. So that testosterone it can causes the cancer. And second hormone androgen they secreted from the testes is a dihydrotestosterone. Its action is similar to the testosterone. It is also involved in the development of the genital organs and development of the sexual characters in the male. And as well as the androgen, so they are also secreted from the adrenal cortex. So these are the weak androgens. It means so they do not affect that much in the sex development of the secondary sexual characters or regulations of spermatogenesis. So they have a weak action on the sex differentiations or in the productions of the sperms or the development of the genital organs or sexual organs. But so these hormones, so those are secreted from the adrenal cortex. So they are strong anabolic. Anabolic means so they strongly enhance the development of body by enhancing the synthesis of the protein. So that's why so those androgens, so they are secreted from the adrenal cortex. So they are the weak androgen but good anabolic steroids. So they are involved in the to enhance the synthesis of the protein. So that protein is required for the development of the body. And the hormones examples are a dihydroepiandrosterones, then as well as the androstenedione. So these are the weak androgen. So they are secreted on the adrenal cortex both in male as well as the in female. Okay, if its concentration is more means so they are counted into that is a estrogen in the female. So that estrogen it can cause abnormalities or it can convert into a testosterone. Okay, so these are the classifications of the androgens. So now we can learn regarding the mechanism of actions of androgen. So androgens, natural androgens, so they are testosterone, androstenediones, then dihydrotestosterone, that is the DHT. So they are released from the adrenal cortex or testes and ovaries. So they are mainly acts on the certain receptors. So those receptors are known as the androgen receptors. And androgen receptors also example for the nuclear receptor. It means so these receptors are present in the nuclear membrane, not a plasma membrane. So they are entering the cytoplasma. From the cytoplasma, so they acts on the androgen receptor. So those are present on the nucleus of that particular type of the cells. So where they enhance the DNA transcription, that is the productions of the DNA. Then further, they enhance the synthesis of the mRNA from the DNA. So this mRNA, it can contain the message or M code for synthesis of the particular type of the protein. So these all process, so they are occurs inside the nucleus. From the nucleus, so mRNA enter into a cytoplasma. From the cytoplasma, so they reaches to the that is the ribosomes. Then the ribosomes, they can read the message from the mRNA template with the help of the rRNA, and it can collect the amino acids from the tRNA. Then it is involved in the synthesis of the protein. So like that, the androgens, so they are involved in the development of the body by enhancing the DNA transcription or by enhancing the formations of the mRNA from a DNA by enhancing DNA transcription. So those mRNA reaches to ribosomes and involved in the protein synthesis. So this is regarding the mechanism of the all the androgens, including estrogen and progesterone. So all are estrogen acts on the estrogen receptors and progesterone acts on the progesterone receptors, and androgen, so they acts on the androgen receptors. So all are the nuclear receptors. So they are present on the nuclear membrane, and always, so they are enhance the transcriptions of DNA through a activations of the protein kinase A enzymes. Okay, next regarding pharmacological profile. So first one is the androgenic effect. Androgenic effect means it includes the development of the sexual characters, or it can regulate the development of the genital organs. So that effect is account for the androgenic effect of the androgens. So here the androgens in the fetus, they can promote the development of the male reproductive tract regarding internal genital organs or vast difference, then as well as the epidermis, and even the testosterone, it is involved in the sex differentiation, that is male and female in the fetus. So it is the rule of the testosterone. If testosterone secretion in the first 3 months, if it is less means, so on that term there is the sex differentiation can be lack. So there is, so that child is the abnormal birth. So because of lack of testosterone in the fetus, so that's why during the first 3 months or trimester, so that lady should be free from the stress or anxiety or depression. If it is still present means the testosterone secretions can be abnormal, then the development of genital organ can be decreases, or even properly the sex differentiation does not occurs in the womb due to lack of the testosterone in the fetus. And during the puberty, the androgens, so they can promote the development of the primary sexual characters like enlargement of the penis, scrotum and testes. So that is during puberty, so it is mainly depending upon the secretions of testosterone also. So they are play important role in the development of the secondary sexual characters like male body shape, that is strongest of the bone, strongest of the body as compared to females, then as well as appearance of the axillary and pubic hairs, deeper pitch than of the voice or wide voice as compared to female, then thickening of the skin or greasy and less subcutaneous fat. So these are the secondary sexual characters. So those are also regulated or promoted or increases by the testosterone during the puberty. In the adulthood, due to more secretions of the testosterone, the baldness is occur. That is the damage of the hair follicles. So due to that, the baldness is occurs, or hair loss can be occurs due to over secretions of the testosterone. Then as well as it can enhance the blood pressure, then it can causes the prostate cancers. due to over secretions of the testosterone, because the over secretions of testosterone in the presence of the 5 alpha reductase enzyme. So this testosterone is con converted into dihydrotestosterone in the presence of the 5 alpha reductase enzyme. So this dihydrotestosterone, if its concentration is increases, means it can cause the prostate cancer in the male. If it is only the testosterone is increases, then this enzyme is not activated by our body system, then that candidate do not suffering from the prostate cancer. If it is this enzyme is more active and testosterone is more secreted, that can convert more testosterone into dihydrotestosterone. So that dihydrotestosterone, it is responsible for to cause of the prostate cancer. And in the testes, the androgens, so they can promote the spermatogenesis, that is the productions of the sperms, and as well as the maturations of the sperm is also depending upon the androgens, or especially the testosterones. Then moderately high dose, they can cause the testicular atrophy by enhancing the synthesis of the muscle in the testes. So that condition is known as the testicular atrophy by inhibiting the GN secretions. But in high doses, so this effect can be sustained and it can cause a less marked atrophy. But only in the moderate dose, it is responsible for to cause of the testicular atrophy. And regarding the anabolic effect, so anabolic effect means they can enhance the synthesis of the protein, and protein synthesis is mainly depending upon the nitrogen present in our blood, that is the positive nitrogen conditions, or presence of the amino acids, or transports of the amino acids, or it is mainly depending upon the number of DNA and number of RNA. If positive nitrogen present means it can enhance the synthesis of the protein, because two amino acids, so they are bound by a peptide bond, so that peptide bond is mainly depending upon the nitrogens. In the blood, in the nitrogen more means it is more entering the ribosomes. In the ribosomes, it can accelerate the synthesis of the proteins by utilizations of the amino acids. And amino acids, they are the key factors for synthesis of the peptide, for synthesis of the protein. And this all regulation is mainly depending upon the DNA, because the DNA, it can decide which protein is required for the development of the body, which protein is required for the development and forms of the muscle. So that message can be generated with the help of the nucleus, in the nucleus by a DNA. Then the DNA can be transcripted, then can convert into RNA. Then the RNA play important role in the synthesis of the protein. So like that, the androgen, so they can accelerate the anabolic effect. So regarding the effect, so they can support the puberty growth both in boy and girls. So whatever the development of body, development of genital organs, development of the physics of the body in both male and female, that can depending upon the testosterone. Even in the female, that can depending upon the estrogens. But in male it is depending upon the testosterone. In female also, it can favor the development of the body or growth of the puberty stage in the both boy and as well as the girl. And as well as the androgen, they can enhance the bone growth regarding thickness and length. Under the influence of testosterone, the height was increases. During the puberty stage, if the student having the less testosterone due to need preparation or many other workload on their brain, so due to that their growth can be stunted. If those students, so they are free from the anxiety regarding the exam preparations or any others, so that candidate only healthy develop due to development of the bone regarding thickness and length. So that's why if any your brother or sisters are there in your home, so during the puberty stage you can insist to them they should be free from the anxiety, so they should be free from the depression, so they should free from the stress. Otherwise it can cause abnormalities in the development of the genital organs, and lack of genital development of genital organ, so that can cause the infertility in the both male as well as the female. So that is only depending upon the status of the brain. And as well as the androgen, they can enhance the synthesis of the estrogen, because so more secretions of testosterone in the ovaries or in the adrenal cortex, where another enzyme is present, so that is known as the aromatase enzyme. So this aromatase enzyme, it can convert dihydrotestosterone into estrogen in both male and as well as the female. In male, if it is more formed due to overactivity of the aromatase, where it can cause the fusion of the bones, or it can fuse the utilizations of the mineralization. So due to that, after certain age, the growth of the height can be stopped in the male, but in the female, after maturation, the growth of the height is stunted due to only estrogen or estrogens. Okay, female after menstrual cycle start, that candidate will be having a sufficient concentration of estrogen. So that estrogen, it can cause the epiphyseal pause, or it can inhibit the growth of the epiphyseal cartilage. So that epiphyseal cartilage, it can present in the top of the bone. It is involved in the absorptions of the minerals. If it is pause, or it can be seal, so due to conversions of estrogen in male and due to estrogen or estrogen in the female, so that can fuse the longitudinal growth of the bone. So due to that, their height can be stopped after the start of the menstrual cycle in the female, and in the male after overproductions of the testosterone after certain 21 age or 18 crosses. So where the testosterone secretion is more due to hormonal changes, so there where their height can be stopped. If they are having correct concentration, still their height can be grow. Okay, so then as well, because of only, so these enzymes, this enzyme convert testosterone into estrogens. The next one is the androgens. So they are also play important role in the muscle buildings. So if during the exercise, if the testosterone secretion is more due to more oxygen supply to the brain, so due to that, the muscles can be built more by enhancing the synthesis of the protein in the muscle by dihydrotestosterones. Then it also causes the nitrogen, positive nitrogen balance, then minerals and water balance. That is helpful for, then due to positive nitrogen, it is helpful for the synthesis of protein. So due to mineral balance, it is helpful for to regulate the functions of CVS as well as development of bones, and water balance, it is helpful for to regulate the osmosis or water balance of body, that is can regulated by the testosterone. And testosterone is also increases the weight or appetite due to enhancing the formations of the muscle mass. Due to that, the weight can be increases under the influence of the androgens. So androgen is also stimulate the RBM, and RBM is the site for the synthesis of the RBC and as well as the blood cells. Here the testosterone, they can stimulate the functions of RBM, then RBM it can secrete the more RBC. So that's why the male having more RBC as compared to female. Male having around an average, that is 5.4 millions per cubic millimeter of blood, and female having around 4.4 to 5, that is the millions per cubic millimeter of blood. It means the female having less RBC as compared to male due to only testosterone. So testosterone, it more secreted in the male, it can stimulate the RBM. So due to stimulations or increase the functions of RBM or red bone marrow, the synthesis of RBC is more. So that's why the male having more hemoglobin as compared to the female, because so these androgens, so they can stimulate the erythropoiesis. So these are the anabolic and as well as the androgenic effect of the all androgens. They are always involved in the development of the body or development of the secondary sexual characters. Regarding pharmacokinetic, so it is when administered by oral route, it can easily undergo the first pass metabolism without showing any effect. It can enter in the liver and it can metabolize. When we are administered through a oral route, so that effect was known as the first pass metabolism. So due to that reason, so the androgen, so they are administered by a IM injections. So they are administered by IM injections or synthetic preparations are used. Then they are highly transported in the plasma by binding with the, that is sex hormone binding globulin, that is 98% of androgen. So they are bound with the sex hormone binding globulin, so they are present in the blood as a proteins, and remaining less quantity are 2%, so they are bound with the albumins. So they are transported in the blood from one place to the another place where they are required, then they are released, then they are manage the functions of the all androgens. Then they are metabolized in the liver and produces the two active metabolites like androsterones and etocolons. Then excretion, so they are excreted through the urine after conjugations. Okay. So next, regarding the ADR, so these are mainly causes the virilizations, that is the estrogen dependent memory carcinoma. If aromatase activity is more, means that can convert more testosterone into estrogen, so that estrogen it can causes the memory carcinoma or cancer of the memory glands in the, that is in the female. Then as well as it can causes the cholestic jaundice, because the testosterone it can enhance the accumulations of fat or accumulations of muscle regarding the cholesterol. So due to more cholesterol, it can causes the fatty liver or cholestic jaundice by a androgens. Then it is also enhance the sustained erections or sexual characters, that is known as the preabsums. Then as well as it can causes the oligospermia, then it can cause the oedema, that is swelling due to increase the accumulations of salt and water retentions. Then as well as it can uh, causes the precocious puberty and short suture, that is development of the sutures. Then as well as it can cause the ascens, then hepatic carcinoma, and due to accumulations of fat or cholesterol in the liver, so that can responsible to cause of the or damage of the hepatic cell, so that responsible to cause of the hepatic carcinoma. Because if more cholesterol is accumulated, means it can more metabolize. So to more metabolism of cholesterol, it can produce the more free radicals, and those radicals is responsible to cause or to damage the hepatic cell. So that condition is known as the hepatic carcinoma. In male, it can over secretions of the androgen or administration of androgens, so they are caused the gynecomastia, that is the enlargement of the breast in the male, not in the females. Okay, so that is the enlargement of the breast in the male. So that condition is known as the gynecomastia. It can occur due to over secretions of testosterone or dihydrotestosterone or over administration of the androgen derivatives or synthetic androgens. And regarding the therapeutic uses, so they are used for the androgen replacement therapy, that is known as the ART. So where androgens is not secreted in the human, that is the male body, so due to that, that candidate was suffering from the less sperm productions or less sperm numbers. So due to that, that candidate was suffering from infertility or irregular management of the blood pressures or irregular management of the RBC synthesis. So on that time, so the doctors they are administered the androgens to correct the sperm productions, to accelerate the erythrocytes or to enhance the development of the secondary sexual primary and secondary sexual character in the male, or development of the genital organs in the male if it is abnormal due to lack of testosterone, where they are administered the androgen. So that therapy was known as the androgen replacement therapy. And androgen is also used due to malfunctions of the pituitary gland or hypopituitarisms. So due to that, the gonadotropin they do not release the LH. So lack of LH, so these hormones do not secreted. So on that conditions also there are malfunctions of pituitary gland. So these androgens are administered by a IM routes. Then as well as, so it can helpful for treatment of the muscular wasting in the AIDS patients. So in the AIDS patients, so gradually their muscle size can be decreases, they become the more and more and more and thin. So that condition is known as the muscular wasting. So that condition is also reversed, so with the help of the androgens. If you administer androgen to the AIDS patient, means so that androgens they enhance the protein synthesis in the muscle, and they enhance the muscle productions or muscle mass production by enhancing the muscle protein synthesis. Due to that, it is helpful for to treat the AIDS related muscle wasting. Or normally, if any candidate having to want to build up the body due to lack of development of the muscles, so on that time also, so they should be take the testosterone as a steroids. Or so those are going to the gym, so they also take the steroids. So that steroid is also containing the androgens, or they are also containing the glucocorticoid. They enhance the body buildup and avoid the muscle wastings. Then as well as the testosterone, it can enhance the aging, it can avoid the aging by enhancing the antioxidant property in our body, by enhancing, because it can enhance the synthesis of RBC. So due to more RBC, more hemoglobin is present. If more hemoglobin, more oxygen can supply to the all the organs. So organ utilize the oxygen and involved in the to removal of the dead cells. So due to that process, the aging can be avoided. If you're having early aging or early age, if you are looking like a old means, so on that time you can stimulate the testosterone secretion in our body, or you can take the artificial testosterone, or some food are there, so their food they can enhance the secretions of the testosterone in your body, so that food is helpful for to avoid the aging. Even you are crossing the 70, still you are look like a B Farm third year students, or the B Farm third year fifth students. So like that it can avoid the aging by enhancing the supply of the oxygen through a regulations of the erythropoiesis. So these are the therapeutic uses of the all the androgens. So they are helpful for treatment of the malfunctions of pituitary gland, as well as to avoid the muscle wasting. Then even they are helpful for to avoid the aging, and they are commonly used the treatment of the androgen replacement therapy, or also known as the ART. Okay, so you have any doubt?